medicine and finally learn how to save money on your next doctor bill. Tune in every Friday from 11 a.m. to 12 p.m. on the Blue Stream.
On FishbowlRadioNetwork.com. Jump in.
Welcome to the Business Doctor. Medical and other information on this show are not intended to diagnose, treat, cure, or prevent disease or any medical condition. The views and opinions expressed on the Business Doctor are those of the authors and do not necessarily reflect the official policy or position of any company or agency of the U.S. government. Now, get the inside secrets behind the business of medicine with the Business Doctor. Happy Friday. Welcome to the Business Doctor. This is Chris, the Business Doctor. I'm joined by Mercedes. How are you, Mercedes?
I'm good. How are you, Chris?
Awesome. Today on the show, we're going to be talking about the true cost of healthcare, where your money really goes, and then current news and Bites with Ben's.
Ooh,
Sounds
exciting.
like a good Friday.
Yeah, good lineup.
Now, the weather kind of sucks today. Not as good as it was last Friday, huh?
Yeah, not at all.
So, Mercedes, anything planned for the weekend?
Nothing. Probably, I want to try out a new brunch place. Laduni, heard great things.
Yeah, where's that
McKinney Avenue.
Okay, you're going to tell us all about it, Bites with Ben's?
I will.
Okay. So, you know, this is the 4th episode, and we've been going through, we've talked about, are you getting ripped off by the doctor? We've talked about, why does it take so damn long to see the doctor, right? The horrible experience waiting. We talked about, what did we talk about last week? It's bad, I can't remember. It was a week ago.
Ripped off.
God, last week was what your doctor doesn't really want you to know where the money's going, right?
Yeah.
So this week is kind of more to you on the consumer of where is your money going? So what does healthcare really cost? So I put a video out this morning talking about the show a little bit. The U.S., we've got something to be proud of. I guess we're number one. We're number one in a lot of things, but what you may not know is we are number one in U.S. healthcare cost in the world. We're also, we're not number one in being the healthiest, but we sure know how to spend money in healthcare. Yeah, and on healthcare. So we have the highest healthcare cost, and I put a little teaser on there that said, if you wonder why if you don't get raises as much, you can blame healthcare for that. So we'll kind of talk about that today. So where does the money really go? The Census Bureau published something to shed light on particular on where does U.S. healthcare dollars go. And doctors and dentists account for 27% of the $1.6 trillion in healthcare revenue. So healthcare is a $1 trillion business. So when we talk about is healthcare a business or not, you bet your sweet ass it's a $1 trillion business.
It is.
So that's why I say healthcare is business first.
Yeah.
And you better know where your money is going, right?
Exactly.
So if you have insurance, which there's a law that says you have to have insurance now, right?
Yes.
So why don't we get treated like a consumer, right? Whole theme of the Business Doctor. So while it's worth to note that $117 billion in social assistance is included with line items like children's daycare, community housing assistance, and other rolled over into the healthcare social assistance category. Without the social assistance, healthcare spending is actually $1.45 trillion, or 11% of the U.S. GDP. So where does your money really go? So if you have insurance, right, you pay that nice monthly premium, you pay a deductible, right? Yeah. Well, it's sad to say, but all that money that you spend really doesn't go to paying for your health care. So I won't go into my tangent on why I don't like healthcare insurance companies. Some I do, some I don't. But they really don't go to what I would say the true cost of healthcare. Yeah. And I can't spoil too much because we're probably a few years away of launching something that can kind of challenge this. But it's kind of interesting to see that according to the American Association of Kidney Patients, total dialysis spending is actually $18 billion and will rise to $28 billion. It already has risen to $28 billion, almost 2% of all healthcare spending. So when you start to look at not only where does your money go in healthcare that you're spending on premiums, right?
Yeah.
But where does it actually go in overall in healthcare, and where do problems happen? So like heart disease is a big problem. So don't smoke, right?
Yeah.
Take care of your heart. Heart health is important because a lot of money, right? I think heart disease is the number one killer in the U.S. So we have this high costs in healthcare. At one extreme, fiscal conservatives might argue that the government has no business in healthcare, and Medicare and Medicaid should have never been created. Now, I disagree with that a little bit. I do think healthcare should be private, and one day we'll talk about, is social medicine a good thing or not a good thing? And you hear the stories, right, from other places, most recently in the UK.
Yeah, but the backside of that is the long wait times also. People here in the U.S. complain about waiting so long to see the doctor, but just imagine if it was free. So, of course, everyone's going to go take advantage, and you would have even longer wait times, or it might take months to get that one procedure that you need.
So what do you say about in recently in the UK, the baby, the kid who had cancer or had some disease, and the parents raised money to come to the U.S. to get treatment, and the UK government said no.
Oh.
Said you couldn't come because they didn't believe that it would help the kid, right? So that's where you get into government, right, deciding whether or not you're going to have health care or not.
I had no idea they had that much control.
Absolutely. Government pays for it, right? So they could control what you do with your
Yeah.
health care. So there's pros and cons, but there's pros and cons of everything, right?
Of course.
I mean, I think for the most part I'm a capitalist, so I like things to be less government control,
Yeah.
more private. You and I, and people listening could do better with spending money than what the government can. But there is a ton of fraud, waste, and abuse. We were talking a little bit this morning about fraud, waste, and abuse.
Yep.
And so we had this idea, what if we took the business doctor undercover, right?
Oh, yeah.
And went undercover to look for fraud, waste, and abuse in
Yeah.
healthcare, because it's out there.
It is.
And it's part of why healthcare is so damn expensive.
It is.
And we get kind of screwed, right, on the
Unless you
flip
know
side.
better.
Unless you know what to do, unless you're listening to the business doctor.
Exactly.
And you know how to save money and demand a better experience as a consumer in healthcare. So what's interesting, so my father passed away in November of last year, and he went on dialysis. And the problem of dialysis is interesting because it is something that represents the issue of overall U.S. healthcare that the U.S. healthcare system is facing. So should universal healthcare or even limited assistance be extended to like diabetics as a way to reduce the number of kidney failure patients? Should it be? Should dialysis patients be assigned a lifetime spending cap, as is done with private insurance? So the patients have to shoulder the burden, beyond a certain point. And I think I was fortunate to be part of a great company that helped patients a few years ago, and we kind of had this rule that if a patient went on to hospice care, that we didn't collect from them anymore. That if the hospice wouldn't pay us, we didn't care. We didn't go get our equipment back. We said, you know what, it's the end of life. They've enjoyed our product, for as long as the life they can. Our product gave them the ability to be mobile and enjoy the rest of their
Comfortable.
life. And so, you know what, there's more to life than a dollar.
Exactly.
And let them enjoy the rest of their life with it. And so that was pretty neat to kind of see that. And that's where you go, that struggle of, is it healthcare's business?
Yeah.
And it also costs to run that business, right? But then there's also kind of doing right and good things that
Yeah.
you kind of have to balance the two. And that's where leaders in healthcare, you kind of have the struggle in making that decision.
And I feel like that puts a lot of families or people who are at that stage of, end of life, they sometimes don't even want the care because they don't want the burden of the cost or the bills to fall on their loved ones when they pass. And I don't think that should actually factor into you receiving care or not.
That's right. So you had just told me asked me to look at something today. So we're going to talk about spending time in the hospital, right?
Yeah.
So where does the cost of healthcare goes? You mentioned on the last show that you had went in for something, and you got your bill.
I got my
How
bill
much
today.
was it?
A lovely $6,000.
$6,000. Now, did it say how much the insurance paid?
I don't think the insurance has paid out yet. I just have the claim. My mother sent me the login.
Nice.
But I'm definitely going to go over my claim and see what they billed me for, because I'm pretty sure I got billed for medication that I denied.
Yeah. So spending time in the hospital is very expensive.
Yeah.
And they can also it can be confusing, right? if you don't remember maybe something, you're in the hospital for a reason, right? You get
Yeah.
this bill that says, here's all these charges, and people make mistakes,
Yeah.
right? So I mentioned fraud, waste, and abuse. There's a difference from fraud and then someone making mistakes. So I don't want anyone listening to think that, oh, well, Chris, the business doctor, medicine's business expert, said that, if somebody billed you for something that you didn't get, that it's fraud. And that's not the case.
Yeah.
People do make mistakes. That's why you have to be vigilant and diligent as a consumer to know, right? I went somewhere a few days ago and group of people, and I got the bill, and it was $150. And I'm looking at the tab, kind of going, what the hell?
Yeah.
And so I started adding up the numbers to it and realized that they charged me $70 more than what the actual bill was, right? People make mistakes. So
Yeah.
it can happen in healthcare too. So I'm not saying that just because you get billed for something doesn't mean that they committed fraud.
Yeah.
But you need to look at it and know what the hell you're looking at to make sure that you're not, right? So
Yep.
I'm going to take a look at Mercedes' bill and see if it's truly $6,000. And Mercedes, we should make this as a little case study,
Yeah.
right? We'll mark out all the private stuff, right?
Yeah.
But let's see if we can get that bill down by 25%. So it's fine
Let's.
if there's anything wrong with it, okay?
Yeah.
And then let's negotiate, right, with the hospital.
Yep.
And then we'll be able to post that for the viewers and listeners to
Sounds-
know how can you save money on your medical bills.
Sounds good to me.
So while I'll tell you kind of what to do, you should not ignore the medical bill, but you also, I'm not saying just go pay it right when you get it, okay?
Yeah.
There is ways to save money on there. So we'll do this as a case study with Mercedes and see what's going on. So when the insurance, so Mercedes is going to look on her claim, and it'll say in there what the hospital billed, which hospitals are going to bill a hell of a lot more than a doctor is going to bill.
Yep.
Even though a doctor is a doctor, right?
Yeah.
So not
It's
really
kinda
sure
weird.
why. Now you do have a big system and a big facility to pay for, but
But they also charge you different fees if the nurse practitioner is doing something compared to the physician, correct?
yeah,
So
sure.
I feel like a lot of people don't pay attention to things like that when they're in the ER, of course, because you're not at your best. But I did.
Yeah.
So I'm excited.
So according to the Centers for Medicare and Medicaid Services, CMS, roughly 32% of our total healthcare expenditures and 38% of our personal healthcare expenditures went to hospitals in 2016. That included money spent towards inpatient care as well as outpatient services provided by a hospital, from a routine blood test to an outpatient surgery or emergency room visit. So last week we talked about what your doctor doesn't want you to know to make more money, and one of those, talked about ambulatory surgery center owning the lab tests, et cetera, right? If the hospital runs a blood test, that thing is going to be hellacious expensive. And what you don't know is you can get a blood test. You could take a urine test, et cetera, usually for $75 to $100. But the hospital is going to bill thousands, if not tens of thousands of dollars for it. So if you think about this, routine visit, blood test, outpatient surgery, et cetera, that's included in that 38% of our total personal healthcare expenditures went to hospitals. Though a large portion of the healthcare money still goes to the hospital, it's less than it was in 1980 by about a percent, when it was 39%, and 46% of our personal health care expenditures in hospitals. So, I think there's something that you should look at, and you see now popping up through all of the country, and the entire country, these pop-up ERs. And the reason for that is to try to lower the cost. You get, the kind of the concept is better service, lower cost, because you don't have this big health system, big hospital that's there. But I still think it's such a problem.
Yeah, we actually talked about it in my healthcare management class. It was a couple semesters ago, so the intro course. But it was funny, the dean teaches the class, so he's a fun guy. But he was
Nice.
saying the freestanding ERs sometimes, well, I guess they're allowed to charge the same amount that a hospital would charge because freestanding ER is in the title, and they don't have the oncologist on call, they don't have a radiologist on call, they don't have all the specialties on call like a hospital would, so they're really not incurring the true cost of a hospital, but they're billing for the same.
Yep.
So I've gone to a freestanding ER, and I've still come out with a $5,000 bill.
Yeah. So we're going to get ready to take a quick break. When we come back, I'm going to tell you something to look for, that if you've gone to one of those pop-up ERs, something that you really need to look for to save money. Otherwise, you're going to be like Mercedes and walk out with a $5,000 bill at a pop-up ER. We'll take a quick break and be right back. You're listening to the Business Doctor on Fishbowl Radio Network. You're listening to The Business Doctor. Medical and other information on this show are not intended to diagnose, treat, cure, or prevent disease or any medical condition. The views and opinions expressed on The Business Doctor are those of the authors and do not necessarily reflect the official policy or position of any company or agency in the U.S. government. Now, get the inside secrets behind the business of medicine. Hey, we're back to The Business Doctor. This is Chris, the Business Doctor. I am medicine's business expert. I'm joined by the always lovely Mercedes Carter. Hey, Mercedes.
Hello.
So right before the break, I'd said I was going to tell you how Mercedes went to a pop-up ER and still walked out of there with a $5,000 bill. So here's something that you need to look out for and watch and ask this question. Is that facility licensed as an ER, as an emergency room facility? So one thing I've seen happen is, since healthcare is business,
Yes.
it is the business of medicine, I've seen doctors get pretty creative. So what they do is they'll market as just your regular doctor, right? They'll have a nice facility. They'll market as a doctor or maybe even market as an urgent care. But what they'll do is they're really licensed as an ER. And so what they'll do is that they have one ER doc, right, that's an emergency medicine doc on staff, and then it's nurse practitioners.
Yep.
So you think it's a normal doctor or you think it's an urgent care, it's going to be a little bit lower expenses, right? Until you get the bill and you're like, what the hell? This is for an emergency, right?
Yeah.
So, a regular doctor versus an urgent care versus an emergency room, they all can bill different prices for the code. So the emergency room is going to bill higher. So you should ask them before you go in, if you're not sure if it's an emergency room, right?
Yeah.
If it's a doctor that maybe looks like a little pop-up box, and maybe it's an urgent care, but you're not sure. There's nothing wrong with asking them, are you an urgent care or are you an ER?
Yeah.
Because that's going to make a big difference on the bill that you get.
Yeah.
So look, it just saved you 25% on your bill right there. There's nothing wrong with asking, and I've seen this happen. There's one doctor around town who, Dallas, Frisco, a few other surrounding cities that has 4 or 5 of these opened up, and it's not that there's anything wrong with it, right? It's just people don't know to ask, and they think, hey, so what? I went and saw the doctor. I really don't know if there's a difference in price or not.
Yeah.
So America's Health Insurance Plan, the HIP, the National Association of Private U.S. Health Insurance, released an interesting report that presents that for insured patients younger than 65 years of age, the financial statistics, now this goes back to 2014, that says, according to the report, your premium dollars, where does it go? So it leads back to 2014, and I haven't found any statistics that are more recent, right? They're usually 4 to 6 years old when we get new data.
Yeah.
But it says that 79 cents of your premium dollar is spent by insurers on healthcare proper, 17.8 cents on the insurer's operating cost, and 2.7 cents as profits. Now, you might be thinking, well, 2 cents as profit, that's not a lot.
Yeah.
Well, I encourage you to go look at, Humana, other public companies or insurance companies' profits, and you'll see that it's there. And what they're not showing is what is the total cost of everyone, right, that's under a certain age, because the healthier you are, the more that your premium dollar is paying for other people's health care. Okay? So there's an interesting analogy when we talk about should healthcare be free or not, right?
Yeah.
So I think that everyone should have the right access to healthcare. Now, whether or not it should be free, someone has to pay for it, okay?
Yeah.
And so you get into the government, should it be government pay for it? Well, someone's got to pay for it. We're going to pay for it one way or the other, right?
Exactly.
But here's why I am not a big proponent fan of free healthcare. So let's say your car breaks down, right? The engine stops working. You take it to the mechanic, and the mechanic says, the engine's not working and looks like you have no oil in the car.
Yeah.
Well, you go, yeah, I didn't pay it, but I still want you to replace my engine for me. Well, the mechanic's going to go, I can't replace the engine, right? It's not covered under warranty. You didn't maintain it. You didn't maintain the car.
Yeah.
Provide the proper maintenance to it, right? So it's not under warranty. Well, I look at healthcare as the same way, right? If I'm not maintaining my healthcare, right, my body, my health,
Yeah.
why should I have to pay for someone who's not maintaining it, right? So if you were, like, I'll take my father, right? My father smoked every single day. Well, why do I want to pay for him? He's not maintaining his body, right?
Yeah.
He got sick. So if you don't provide the proper maintenance, right, then why am I going to pay for something that someone's not doing? Because the mechanic's not going to pay for the engine,
Yeah.
right? That's for sure.
No.
Or you're not going to get it for free
No.
because you didn't maintain it properly. But I think that they go hand in hand with the cost of healthcare to obesity, to
Yeah.
general health, right? Really, things about maintaining yourself, exercising and eating a good
Better.
diet or eating healthier and so
Yeah.
forth, right? Let's see, the nearly 80 cents per premium dollars that insurance report that are spent on medical expenses, known in the insurance jargon as the medical loss ratio, is it's a portion of premiums collected from health insurers that lose to physician, hospitals, and others who offer health care. So the Affordable Care Act mandated that the MLR of at least 85% for large insurance companies and at least 80% for smaller carriers. And by their own admission, insurers selling policies for individually purchased health insurance before the Affordable Care Act went into effect tended to have MLRs in the 55 to 65% range. So what you see now is what before, right, really 50 cents of a dollar actually went to healthcare.
Yeah.
And, the Affordable Care Act made that go up, but then you had a lot of insurance companies stop. What do? They stopped providing on the open market
Yeah.
with the Affordable Care Act because their profits weren't as
What
as
they
high,
were.
right?
Yeah.
So what prompted in the last few years of what we do today was I had to get on healthcare. Now, I went for about 2 years and I didn't have insurance. And I didn't have insurance because I did the calculations and found that it was less expensive for me if I go to the doctor, and I maybe went once a year, maybe twice,
Yeah.
to pay the $100 than it was to pay $150, $300 a month, whatever, for insurance premium. So I looked at the cost and I put money in savings, into a high yield savings account, and said it's much cheaper. And then when the Affordable Care Act said you'll get penalized and have to pay a fine, I'm like, well, this is bullshit.
Yeah.
Right? I've done the math. It's cheaper for me to not have insurance.
Yeah.
Right? I'm putting money into a high yield savings account. I'm making money off of this,
Yep.
and yet I'm going to get penalized for it, right? So then I said, well, you know what? Fine. If I get sick, guess where I'm going to go? The emergency room, and I'm not going to pay the bill, right? Because that's why you end up having to paying that penalty at the end of the year, right?
Yeah.
It was to pay for the people that didn't pay the health care, right? So I said, well, look, I'm going to go and I'm not going to pay because that's going to be my premium, right?
Yeah.
Me paying the insurance. And it had an adverse effect. And, everyone's might not be like me in that, I'm calculating the cost risk pool of whether or not it's more cost effective for me to have insurance, not have insurance. But I also knew that about 50 cents of the dollar actually went to my health care. And so I'll be damned if I'm going to give insurance companies money
Yeah.
and keep half of it for profits
Yeah.
when I could put it in a savings account myself and make money off of it, right? I'd rather do that
Only makes sense.
all day, of course. But the AHIP reported that insurance had an average profit margin of only 2.7%. When you're talking billions of dollars, the 2.7%, oh, poor guys.
Right.
The number seems low, obviously, perhaps, because it is a simple average, right? It's not really 2.7%. There's no way.
Yeah.
Profit margins for the larger U.S. health insurance, for example, were much higher than just 3% in recent years, with 4.7% for Aetna and 7% for Cigna. And we're talking billions of dollars, right? So
Yeah.
at 4.7% is a lot of money.
I would take 4.7 of billions of dollars. So.
Yeah, I mean, yeah, if your revenues were like, 5 billion, and you had a 4.7% margin
Yeah.
on that, I'll take that all day.
All day.
So these operating costs that these insurance report is twice as high as are the overhead costs of insurances in much simpler health insurance systems. In other countries, A study in 2010 comparing per capita health spending in Canada and the U.S., for example, found that administrative costs in 2002 accounted for 39% of the total per capita spending difference between the two countries. The differential accounted to U.S. $1,616 per capita. If these costs had grown by a modest 3% per year since, then we would be close to $1,000 per capita now. So one of the things that I do think, and we talked about this on, I think, episode 2, is how inefficient healthcare really is. Healthcare is so inefficient, and that's why there's a lot of high cost to it.
Yeah.
And even the insurance companies, even the private companies, are so inefficient that it just drives cost up, right?
Yeah.
And so I kind of look at it this way. You know, I talk about the analogy: if I go to the hotel and check in, I should get in. I get in really quickly. Well, why is it not the same with the doctor? And it should be.
Yeah.
Is when I go to the doctor, if I get in quickly and I can get in, see the doctor quick, and get out in 15 minutes, that means that room is opened up for another person, right? Another patient to come in, another customer. So I look at the exam rooms as a hotel room, right? My occupancy, utilization.
Yeah.
And if you keep it efficient, then you could see more patients, right, with the same or a little bit more operating cost.
Yeah.
And then it'll be more efficient, and the operating costs start to go down. And it makes it better, right?
Yeah.
Overall, as a customer, too, the customer experience. So here's an interesting study. A study of the cost of medical practices of interacting with health plans published in Health Affairs in 2011 found that practices spend an average of $83,000 per year interacting with health plans. And I got to tell you, that's so true, right? So when you bill an insurance company, right, you kind of got to hope that they pay.
Yeah.
And if they don't pay because they find some reason, whatever it is, then the doctor, the hospital, whomever, has to have staff to go fight it, to try to get paid, right? And you better hope as the consumer that you're not going to get stuck with that bill.
Yeah.
Right? So on the explanation of benefits, it will tell you what the hospital or doctor allowed, what the insurance company allowed, and then it'll say total patient responsibility. So for example, if a doctor does not bill a claim to the insurance company within a certain time frame, they get a denial by timely filing. Well, when that insurance company adjudicates the claim, it'll say patient responsibility, that amount. So if the doctor doesn't get it to the insurance company in a quick enough fashion, right, whatever the rules are, you may be stuck with that bill. Now, the reason for that is, and it's bullshit, but you can get billed for it, and not for what they charge, but what for the insurance company allows.
Yeah.
The reason for that is, what people don't know is you as the consumer are actually supposed to file the claim with the insurance company. The doctor does it as a courtesy on your behalf. Okay?
Oh.
So the kind of the quote, so if you looked at your terms, right, with the insurance company, it would say that, hey, you would be responsible for this because they're doing it on your behalf. And you sign something in the patient paperwork that says, I authorize the doctor to bill on my behalf or the hospital, and I also authorize them to accept payment, right? Because if you were to submit the bill for it, right, you would get paid, and then you would pay the doctor their fee.
Oh.
Right? So they do it as a courtesy to you. But
Courtesy.
yeah, but I still think it's kind of BS, right? I had a call with someone the other day, and there was a few $1 million, right, from a lot of patients.
Yeah.
And the billing company didn't do exactly what they were supposed to, and there was all these timely filing denials, and it says transfer to patient responsibility. And so legally, they have to transfer it to patient responsibility.
Yeah.
Right? Now what's going to happen is you're going to get a lot of pissed off people because people don't know that they could file the claim themselves, right? Or hell, how to even do that.
Yeah.
So it's pretty interesting. So part of that is there's something that I'm looking at right now called a costly coding war. And so there's one reason why healthcare costs are so much is indecipherable medical bills, right? Not only does you, the consumer, read a medical bill and understand it, but also for the people that work at doctors, hospitals, etc., is in which physicians, hospitals, and others who treat patients always do seek to maximize their profits by hiring all these consultants who know how to upcode, right? And I talked about that a little bit. We talked about that last week.
Yep.
About one of the three things, right, that they don't want you to know of how they're making more money.
Yep.
And that's this thing called upcoding. And so there's all these people, who know how to do it and make it legal and make more money, and then you get stuck with it. So that's where the real cost of your money is going. So, I would say 50 to 70% of the healthcare premiums are actually going to actual healthcare. So just know that when you're paying, right, that there's only about 50 cents of that dollar each month is probably actually going to healthcare. And then your true cost of where it's going is these things like the emergency room when you didn't know maybe it was a pop-up ER and you're getting stuck with high bills like Mercedes. Or there's the upcoding, right?
Yeah.
And so we're kind of plagued in the U.S. with high costs because of these problems, right? So I think that's something that we've got to change, right?
Of course. It really starts with patient education, just, putting the patient in a better position to be a better consumer. You don't go buy a car with no knowledge about the average market price. You probably go to Kelley Blue Book or something.
Exactly.
But
and now you just go to medicinesbusinessexpert.com and get the resources you need to educate, because that's all we're trying to do here, Mercedes.
Yeah.
We're going to take a quick break. If you have any questions or you want to tell us about your high healthcare costs, call us at 214-431-5062. When we come back, we'll go talk about Bites with Benz. You're listening to the Business Doctor on Fishbowl Radio Network. You're listening to The Business Doctor. Medical and other information on this show are not intended to diagnose, treat, cure, or prevent disease or any medical condition. The views and opinions expressed on The Business Doctor are those of the authors and do not necessarily reflect the official policy or position of any company or agency in the U.S. government. Now, get the inside secrets behind the business of medicine. Welcome back to The Business Doctor. So, Mercedes, it's
Yes.
Bites with Benz.
we are live.
Tell us about Bites with Benz. What's going on with Bites with Benz?
Bites with Ben's is your food source for the Dallas-Fort Worth area. Last night, actually tried a new Italian restaurant, and it's in the complex of our office.
Millie Liar.
Millie Liar.
Yeah.
Delicious. I had the truffle pasta to die for, probably the best thing on the menu. So
If I wasn't gluten-free, I would tear that up. And I asked them to give me the sauce, like the truffle. I was like, can I just take it and I'll take it home?
Go home.
Make it in my, or can I bring you gluten-free pasta, or will you make some gluten-free pasta? Because that thing is the shit.
It's so good. And the fun fact about most of the Italian places I go to in Dallas are the ones you'll see on my website, biteswithbens.com. All of the pasta is handmade. That's my big thing. I don't want pasta if it's not made in-house. You can taste the difference.
Yeah.
So.
And Millie Liar is
Sensational.
awesome. And they're proud of that too with the prices, right?
Yeah.
They're really proud of it. So that's right below the office.
Yes.
At the corner of Cedar Springs and Oakland, I think.
Yes, Cedar Springs and Oakland.
So you were just telling me about happy hour.
Yes, so I've been getting requests to add a happy hour tab, because who doesn't like happy hour? It's the happiest hour of the day.
Absolutely. And you can go to Happiest Hour for happy hour, right?
Exactly. And there's a lot of places in Dallas who offer $3 drinks, $5 appetizers, and I take advantage of it all.
So will you put on there too? I know there's some places that you can get free appetizers.
Matitos.
Right? Matitos. The Capitol Grill,
Oh.
I think, by where I live.
Yeah.
Or by the apartment over there. There's like different places that will do free, whether it's free abs or half off of something, right, during
Yeah.
a happy hour time frame. So when is a typical happy hour?
Usually 4 to 6. Some places are 3 to 7. Some 4 to 7, but around that area, kind of where traffic starts and starts to wind down.
Yeah. So is
But-
that so you can get buzzed and then you don't have to drive in traffic?
Exactly. But I had a really important point and it just flew away.
Come on.
I know. That's what I'm looking forward to. National Filet Mignon Day.
When is that?
August, in the middle of August. But Trulux, they offer free filet mignon sandwiches at the bar during happy hour. So,
I did not know that.
yeah.
And I go to Trulux almost daily.
Yeah.
At least like 3 or 4 times a week.
Yeah.
How did I know? Maybe I don't go during happy hour. That's why.
They have an awesome happy hour.
Really?
A really good
when
happy
when does
hour.
it start? Now, they don't open until 5, right?
Yeah. So it's probably 5 to 7.
Yeah.
Because I missed it. the other day. I was running late.
So I gotta start leaving the office by 6 or 6:30 to
Yeah.
get there.
Yeah.
Huh. Yeah, I didn't know that, and that's like my favorite place. That's good. No, so they do those filet mignon bites.
Like, yeah, look, little sandwiches,
every day
sliders.
during half hour.
No,
Oh,
not every day.
For
Only-
National Filet
Yeah.
Mignon Day.
Yeah,
When
only in
is
August.
that?
August. So it's probably the first or second week.
So we got a few months away. So
Yeah.
you're
I'm
getting ready.
I am ready.
Now you and I don't eat red meat that much.
Yeah, not that much.
So, but we're gonna go on National Filet Mignon Day. So we're gonna
course.
save up and not eat much red meat until then.
Yeah,
Yeah. That's good. Did you take any pictures of Millie Lar last night?
of course.
Now, do you take pictures of the food? Do you take pictures of the ambiance too in the establishment?
I don't. I'm going to start a vlog and just kind of vlog my whole experience while I'm there because I'm really big on ambiance also. So that's another thing. All the restaurants I go to, you would want to be there.
Yeah, yeah. Now, where's the one restaurant that I've never been that I've always wanted to go to? That's got the motorcycle. above the bar?
Townhurst.
Townhurst.
Yes.
Yeah, I've got to try that.
Yeah, I want to go there too. It's really cool.
Yeah.
Shaped like a nice isosceles triangle. So
Really?
Yeah, it's different.
I'm gonna have to try that one out. All right. Anything else? Bites with Ben's? What's next week on Bites with Ben's?
I'm not sure. Whatever my stomach leads me to.
Yeah?
Really, it's a spontaneous thing.
You think you'll try a new place?
Always going to Nick and Sam's on next Friday for a family birthday dinner. So I'm gonna try the tomahawk steak because I want a 20-ounce steak that can't fit on my plate. Like,
Now tell me about last week. You were telling me after the show about a steak you had at Nick and Sam's.
Wagyu. That
The
was
Wagyu.
really good.
Now you can pick the different Wagyu steaks.
Yes, so I picked the Wagyu that the cow was only fed olives. It was on an olive diet. So if you, I usually cook with olive oil, but you can like really get like the distinct buttery taste, and it was just delicious.
Now, so you could have chosen the one that was only 8 olives.
Yeah.
And then,
There
so was that pretty lean?
Yeah, very lean.
But I assume it was still a normal big-sized cow.
Well,
lean
so
meat,
fun
maybe?
fact. Well, yeah, the meat was very lean, but it's $50 an ounce, and they have a 4-ounce minimum, so I didn't.
Yeah.
I didn't get a lot of ounces.
So you're $200 in for the cow to eat olives. The cow that ate olives cost $200 at a minimum.
Yes.
Right?
And you don't want the 4-ounce. You
No.
at least want an 8.
Was it worth it?
Oh yeah.
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 Was that good?
It was really good.
So what are the other cows that you can get?
There's a sampler that you could get. My friend got the sampler, and you can. We got the Japanese, so it's like the Japanese Wagyu, and that was the ones that royalty only ate, and it was just approved to be in the U.S. in 2008, I believe. So it's still fairly new, but
Nice.
that was the best cut.
Well, you
of
are
it.
royalty, right?
Yeah, gotta eat like an empress.
Yeah. All right. So check out Mercedes' food blog at biteswithbens.com. That is like the Mercedes Benz.
Yes.
So BNZ biteswithbens.com. I promise. Let's see. I'll get a blog out for this week, and I think I'm behind from last week. Out there. So last week is the 3 things that the doctor doesn't want you to know to make more money. So we'll get something out today. So check out Mercedes' food blog at biteswithbens.com, and then you can check out the business doctor at medicines, that's plural, medicinesbusinessexpert.com. Also check it out on Facebook at medsbizexpert. And I
Yeah.
think there's YouTube channel now. There's
The videos are up, audio's up.
on the medicinesbusinessexpert.com on the business doctor website. There's now the video podcast, the audio podcasts are up there. And then we're going to start putting out some videos. And you know what I'd like people to do, if you can, video the doctor experience. Okay, so if you go to the doctor, you're waiting 30 minutes, it's BS. Send us videos of you going to the doctor. So you can do that through Facebook Messenger, I think.
Yep.
You can also send it to medicinesbusinessexpert@gmail.com or go to medicinesbusinessexpert.com and send it there. But yeah, I'd like to see that. So we'll start doing that. I'm going to
Yep.
start going to the doctor.
For fun.
Yeah, for fun to try out new doctors, right? So while you're trying out new restaurants, I'm going to try out new
No.
doctors, all for the people.
Yeah, only
to
for the people.
Give better experiences. So check us out. Check Mercedes Food Blog out again, medicinesbusinessexpert.com. Check out the Business Doctor, medicinesbusinessexpert.com, and subscribe. And we'll see you again next Friday
Yep.
from 11 a.m. to 12 p.m. right here on Fishbowl Radio Network.
The Blue Stream.